name is Grace Davis, and I'm a student nurse practitioner at the University of Memphis. And it is summer of 2022, June 1st, and I'm going to be filming my head-to-toe assessment for my summer clinical rotation. I'd like to begin this exam by stating that I've already washed my hands and verified my patient identity. I'd like to state that throughout this exam, I'm going to be looking at the skin of the head, face, neck, anterior and posterior chest, and abdomen for color, temperature, texture, turgor, moisture, edema, bruises, scars, lesions, and nevi, as well as the skin of the upper and lower extremities for its color, warmth, and skin integrity, as well as assessing for edema. I'm going to start by assessing the face. I'm looking at the head for its size, shape, and midline positioning. I'm looking at the hair for its color, texture, and distribution. And I'm palpating the scalp and assessing for any lesions, masses, tenderness, depressions, or infestations, which there are none. I'm going to palpate your temporal arteries for tenderness. Any tenderness?
No.
I'm going to palpate your frontal and maxillary sinuses for any tenderness.
No.
Any tenderness?
No.
I'm going to palpate the lymph nodes of your head and neck, starting with your preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and your supraclavicular for any tenderness. Any tenderness?
No.
Okay. I'm going to assess cranial nerve 5, which is your trigeminal nerve. I'm going to assess the motor strength by palpating over your masseter muscle as you clench your jaw. And while I'm here, I'm going to have you open and close your jaw. I'm assessing the TMJ for any subluxation, crepitus, or tenderness. Any tenderness?
No.
Okay. I'm going to assess the sensory sensation of cranial nerve 5 if you'll close your eyes for me and tell me where you can feel this light touch.
Forehead, chin, cheek, nose.
Good. I'm going to assess cranial nerve 7, which is the facial nerve, by assessing for symmetry as you pucker your lips, puff your cheeks, smile, frown, and then lift up your eyebrows. All symmetric. I'm going to assess your ears. I'm assessing for the shape and positioning. I'm going to palpate the trachea and the pinnae for any tenderness. Any tenderness?
No.
I'm going to assess the auditory canal and look at the tympanic membrane. I'm going to lift up because you're an adult. I'd pull down if you were a child. And on this side. Okay. I'm going to assess cranial nerve 8, which is the vestibular cochlear nerve, by assessing your hearing. I'm going to start with a whisper test. If you'll occlude one ear, and then repeat back what I whisper.
1, 2, 3.
Okay, now include your other ear.
A, B, C.
Now we can do both.
1, 2, 3.
Okay, I'm going to assess Weber's test for lateralization. You can tell me if it's the same sound out of both sides or one side greater than the other.
Both.
Okay, and then I'm going to assess Ryan's test that air conduction is greater than bone conduction. If you'll tell me when you can no longer hear this.
I can no longer hear it.
Can you still hear it?
I can.
Okay, now on the other side.
I can no longer hear it.
Can you still hear it?
I can hear it.
Okay. I'm now going to move on to assessing your eyes. I'm looking at your lashes, your eyebrows, and your palpable fissures. I'm assessing the sclera and the conjunctiva for any discoloration, lesions, or discharge, which there are none. I'm going to assess cranial nerve 2, which is your optic nerve, by assessing your gross visual acuity and your peripheral and central vision. So if you'll hold this out in front of you and cover one eye and read the lowest line you can.
D, E, F, P, O, T, E, C.
Okay, now the other side.
D, E, F, P, O, T, E, C.
Now both eyes.
D, E, F, P, O, T, E, C.
Okay, that's 20 out of 20 vision. I'm now going to assess your peripheral vision. If you can cover one eye for me. Okay, tell me when you see my finger.
I can see it.
Okay, now the other side. Tell me when you can see my
I
finger.
can see it.
Now both.
I can see.
Great. I'm now going to assess cranial nerve 3, which is the ocular motor nerve, by assessing for direct and consensual pupillary response to light. If you'll look at my nose, I'm going to shine this light in your eye. The pupillary response is intact. I'm going to assess for red reflex and internal eye structures. If you'll just look forward. Red light reflex is intact with no internal eye structures. I'm going to assess for accommodation and convergence. If you'll follow my finger in with your nose. Now look at the door behind me. Now look back at my finger. That's intact. I'm now going to assess, in addition to cranial nerve 3, I'll be assessing cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is the abducens nerve, for conjugate gaze with extraocular eye movement. So if you'll follow my finger with your eyes and not with your head. Okay, that's intact. I'm going to go ahead and move on to assessing your nose. I'm looking at its size and shape, And I'm going to assess for nasal patency. If you'll occlude one nostril and snip up. And now the other side. And your nose are patent. If you'll close your eyes, I'm going to assess for cranial nerve 1, which is your olfactory nerve. If you can tell me what you smell.
German eggs.
Good. I'm now going to assess your mouth. So if you will open your mouth for me. Open up. Say ah. Lift up your tongue. Great. As I was doing that, I was assessing your lips, teeth, gums, buccal mucosa, your tongue, your palate, your floor, your salivary ducts, your posterior pharynx, and if your tonsils are present, I would grade them. I was also assessing your cranial nerve 9 and 10, which are your glossopharyngeal and your vagus nerves, that your uvula and soft palate rose symmetrically with phonation. And I also assessed cranial nerve 12, which is your hypoglossal nerve, that your tongue was midline without any fasciculations. I'm now going to move on to assessing your neck. I'm assessing your trachea, that it is midline. I'm going to assess your thyroid gland, if you'll take a swallow for me. Okay, and one more time. Great. Now I'm going to assess your carotid arteries. And then I'm going to assess your carotid arteries for any bruits. If you'll take a deep breath in and hold it. One more time. I'm now going to move on to my respiratory assessment. I'm looking at the skin of your anterior and posterior chest. I'd be looking for any obvious deformities and for symmetry. I'm going to start with your posterior chest, if you'll turn your back to face the camera. I'd be looking for any obvious signs of respiratory distress that include tachypnea, nasal flaring, retraction, cyanosis, tripod positioning, or retractions. I'm going to start by assessing for symmetrical chest expansion, if you'll take a deep breath in. Great. And now I'm going to assess tactile fremitus. You'll say 99.
99, 99, 99, 99, 99.
Okay, I'm now going to percuss over your lung fields. I'm now going to auscultate your lung fields for clear breath sounds and no adventitious lung sounds. If you'll take a deep breath each time I move my stethoscope. Sides. Good. I'm now going to assess for egophony. You'll say E each time I move my stethoscope.
E.
I'm now going to assess for bronchophony. If you'll say 99 each time I move my stethoscope.
99, 99, 99, 99, 99, 99, 99.
I'm now going to assess whisper pectorilically. If you'll whisper 1, 2, 3 each time I move my stethoscope. Great. You can now move and face towards the camera again. I'm going to assess for symmetrical chest expansion of your anterior chest. If you'll take a deep breath in. Great. And then we'll assess tactile fremitus. If you'll say 99.
99, 99, 99.
I'm now going to auscultate your anterior lung fields for clear breath sounds. Take a deep breath. Okay, I'm now going to assess your heart sounds with the bell and diaphragm of my stethoscope. Starting with the diaphragm, I'm assessing your aortic valve, which is at the second intercostal space right sternal border. Your pulmonic valve, which is at the second intercostal space left sternal border. Erb's point, which is at the third intercostal space left sternal border. Tricuspid valve, which is at the fourth intercostal space left sternal border. And the mitral valve, which is at the fifth intercostal space midclavicular line. I'm now going to assess with the bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. I'm now going to identify and palpate the point of maximal impulse. I would also listen there for a full minute to assess for regular rate and rhythm, and I would be assessing for no murmurs, rubs, or gallops. I'm now going to have you lay back for me, and we're going to pretend that the head of the bed is at a 30 to 45 degree angle, and I would be assessing for jugular vein distension, which there is none. I would be assessing for any heaves or lifts. I would be palpating over each auscultation point for any thrills, which I do not feel any. And now I'm going to listen to your heart with both the bell and diaphragm of my stethoscope, starting with the diaphragm at the aortic, pulmonic, herbs, tricuspid, and mitral. And then again with my bell at the aortic, pulmonic, herbs, tricuspid, and mitral. I'm now going to be assessing the abdomen. I'm looking for contours and symmetry. I'm going to start by auscultating, and I'm going to be listening for vowel sounds in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I'm also going to assess for breweries of the aorta, renal arteries, iliac arteries, and the femoral arteries. Okay. I'm now going to do some percussion of the abdomen for any tympany, flatness, or dullness. Now I'm going to palpate the abdomen for any tenderness or masses, starting with a light palpation. And then moving on to a deep palpation, any tenderness.
No.
I'm now going to assess the liver and the spleen, if you'll take a deep breath in. Okay. And then the spleen. Okay, if you'll sit up for me and face your back towards the camera, I'm going to assess for any CVA tenderness. Tell me if this is tender.
No. No.
Okay. You can now face this way. I'm now going to be assessing the joints of your fingers, wrists, shoulders, elbows, toes, ankle, knee, and hips. I'm going to be assessing for any redness, swelling, crepitus, tenderness, nodules, lesions, or deformities. I'm going to start with the joints of your fingers, your wrists, your elbows, and your shoulders, and then of your toes, ankles, knees, and hips. I'm going to assess capillary refill of your upper and lower extremities, which is less than 3 seconds. And then I'm going to assess your pulses, your radial pulse 2+ out of 3, dorsal pedis pulse 2+ out of 3, and posterior tibial pulse. And then I'm going to assess for hand grip strength if you'll squeeze my fingers, 5 out of 5 strength. Bicep and tricep strength if you'll lift your hands up and then push back down, 5 out of 5. And then your shoulder strength if you'll lift up, push, good. And then that was also assessing cranial nerve 11, which is your accessory nerve, 5 out of 5 strength, and then push back out this way, pull me back in, and that's 5 out of 5 strength. Now we'll assess with the dorsal flexion, plantar flexion, assess your feet. If you'll push down against me, push back up, 5 out of 5 strength, push me out, pull me back in, 5 out of 5 strength, and then push me out as well, and then pull me back in, 5 out of 5 hip strength. I'm now going to assess your vibratory sensation over your proximal ulnar prominence and your medius malleola. If you'll tell me if you can feel this.
I can feel it. I can feel it.
Okay.
I can feel it. I can feel it.
Great. Now I'm going to assess for light touch sensation. If you'll close your eyes and tell me where you can feel this.
Arm, 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 thigh, left leg, arm, thigh, foot.
Okay, light touch sensation is intact. If you'll keep your eyes closed, I'm going to assess for xerognosis and graphthesia. If you'll push your palm out towards me, I'm going to draw a number and you tell me what number it is.
1, 4,
Okay, I'm now going to place an object in your hand. Tell me what it is.
coin,
And over in this hand.
marker,
Okay, those are intact. I'm now going to assess for cerebellar coordination, starting with your serial finger opposition, if you can go like this. Great. And then we'll do a hand flip top, if you'll go like this in your lap and slowly increase speed. Okay, and then we'll do finger to finger, if you'll touch your finger to my finger. And then with your other hand. Great. We'll now assess your reflexes, starting with your brachioradialis. Relax your arm for me, your bicep, your tricep, and then again on this side, brachioradialis, bicep, tricep, and then your patella reflexes, if you'll relax your leg for me. And then over here. And then your Achilles, relax your feet, and then your Babinski, which is negative. We are now going to assess range of motion, starting with your fingers. If you'll flex in, extend, hyperextend, abduct away, adduct together, and then thumb opposition. Good. And then we're going to assess your wrist. If you'll flex, extend, hyperextend, ulnar deviation, radial deviation. And then with your elbows, if you'll flex, extend, hyperextend. And then your shoulders, if you'll flex, extend, hyperextend. And then if we can do abduct away, adduct across, internal and external rotation, and then again with your other side, and then circumduction. Great. And now with your toes, if you'll flex your toes, and then extend and hyperextend, abduct your toes away, adduct them together. And then with your, we'll check your ankle strength. If you'll dorsiflex down, plantar flex up, and then we'll do internal rotation, external rotation, and circumduction. Okay? And then I'll go ahead and have you stand up. And we'll do this of your knee. So if you'll flex your knee, extend, hyperextend, and then again with this, flex, extend, hyperextend. And then of your hip, I'll have you flex back, extend, hyperextend, abduct away, adduct across, internal rotation, external rotation, and circumduction. And then again with the other side, we'll flex back, extend, hyperextend, abduct away, adduct across, internal rotation, external rotation, and circumduction. And then I'm going to have you close your eyes and hold your hands out like this. I'm going to assess Romberg's, which is negative. And then I'm going to have you walk towards the camera just regularly to assess your gait. And then I'll have you walk backwards, heel to toe, to assess your tandem gait, which is intact. And then I'll have you hop in one place on one foot for me, and then with your other foot. Looks great. And then I'll have you turn this way towards the camera. I'm going to go ahead and flex your cervical and lumbar spine down. I'm assessing your spine for any swelling, crepitus, nodules, or deformities, or any tenderness. And I'm also assessing for signs of scoliosis, which there are none. You can extend your lumbar and cervical spine and then hyperextend. And then we'll do a lateral flexion if you'll go like this to assess your lumbar and cervical spine. And then we'll do a rotation of your lumbar and cervical spine as well. And then you can sit back down. And that concludes my exam.